So we've done a great deal of work on the Healthy Montgomery Steering Committee, and our hope is today we can re-engage the community. When the healthymontgomery.org website that the county executive spoke about was launched, I think it got quite a bit of attention and I hope a lot of use. And for anyone who has not looked at it, I encourage it as a tremendous resource to outline and measure where we stand on a wide range of health indicators, and over time, we will use the data that we are compiling on the healthymontgomery.org website to measure our success in reducing the prevalence of health conditions that cause us concern. Montgomery County is often ahead of the curve. When I took office in 2002, George Bush was still president of the United States, and there was virtually no effort underway at the federal level to ensure universal access to health care. And I asked the question, what would it take here in this county to ensure that every resident of this county gets access to health care? And from that was born the Montgomery Cares Network of community clinics, which is still in effect today and which will ensure that more than 31,000 patients without health insurance will get access to care. Now, fortunately, after many years of carrying this burden on our own with only county resources, the federal government has now stepped up to the plate, and so we've seen the extraordinary results of the implementation of the Affordable Care Act. It isn't perfect, but we've seen a substantial increase in enrollment, and I'm very confident that in just the next few years, the next term of whosoever elected officials are successful in this year's election, with the combination of the exchanges under the Affordable Care Act, the expansion of Medicaid, and the continuation of our network of community clinics, we will achieve our goal of universal access to health care, universal coverage in Montgomery County in the next few years. But there was an excellent speech I heard a few months ago where George Benjamin, the executive director of the American Public Health Association, said that once we have everyone covered, our real work has just begun. Health reform is so much more than just insurance reform. And so what we're engaged in now at Healthy Montgomery is we want to continue the work that we started with 6 action areas, of which 2 have now produced action plans: behavioral health and obesity. We're also going to look at diabetes, we're going to look at cancers, we're going to look at heart disease, and we're going to look at maternal and infant health. But beyond those specific health areas, we are going to be embarked upon building an integrated health delivery system that will ensure uniformly high quality, whether you are in the most expensive private pay plan or whether you are a client in our safety net clinics. We will ensure uniformly high quality, and we will pursue the triple aim. We will bring down the cost of care. We will ensure an excellent experience of patient care, and we will improve population health. This is the international model that's being promoted by the Institute for Healthcare Improvement, the triple aim. And so we have assembled on this Healthy Montgomery Steering Committee an extraordinary array of stakeholders: individual healthcare providers, our outstanding hospitals, academic institutions, our school system, other county agencies, consumers, public health advocates, all of the people who are necessary to bring about this integrated healthcare delivery system and make Montgomery County once again the model, ahead of the curve, as we develop our public health policies. The Healthy Montgomery Steering Committee, which we initiated, we were the first in the state, now fulfills the state mandate. Every community in the state must have a local health improvement council based on the Healthy Montgomery model. Now, Montgomery County, we have processes. It takes time. We get a lot of input. And so we benefit from having so many stakeholders at the table, but it also is consultative and a little slow. So we need to re-energize our charge. We need to re-energize our mission. And so today we are relaunching Healthy Montgomery, and hoping that the public will understand that this will be the forum in the next few years where public health policy will be made and public health priorities will be set, so that, as the county executive said, we can take pride in making sure that our county is among the very healthiest in the United States. What I want to do now is close. We're marking the release of the first 2 action plans. And if we could get Kevin Young and Tom Haar and Linda Ashburn and Carol Garvey, Tom and Kevin were the co-chairs of our behavioral health working group, and Carol and Linda were the co-chairs of our obesity working group. I have a proclamation honoring them for their outstanding work in developing these action plans. I'm not going to read the proclamation. It's somewhat repetitive of what the county executive and I have just spoken about, but if we could just take a photo. We want to thank you and all of your task force members for your excellent work, and I'll stand in the middle, and we're just going to present this proclamation here with the county executive, and smile for the photograph. All right, so thank you very much. Our goal is a culture of wellness where every resident understands that it is essential to live well. We're going to reduce utilization by improving the individual's ability to access care, to get good nutrition, fitness, preventative care. These are the models that we want to promote, and this is where Healthy Montgomery will continue its leadership.